Blackwood.
Speaker, I too rise and support this motion that this House condemns the Cook Labor government for failing to give West Australians confidence that the state health system is coping, particularly given the upcoming winter season and concerns from the sector. Mr Speaker, when West Australians call an ambulance, they expect help to arrive quickly. When they arrive at an emergency department, they expect to be seen in a reasonable time. And when winter brings the predictable surge in illness, they expect the health system to be prepared. This motion is about whether West Australians can have confidence that the health system is ready for those pressures. Every year, winter brings increased respiratory illness, increased ambulance demand and increased hospital admissions. These pressures are predictable. The question before this House is whether the Cook Labor government has put in place a comprehensive plan that gives West Australians confidence that this system will cope. Right now, many West Australians do not feel that confidence. The Premier has repeatedly defended the performance of the health system. He has said West Australia has one of the strongest health systems in the country and that this system is performing strongly. But when West Australians are waiting hours in emergency departments, those reassurances ring hollow. Recently, national data shows West Australia now has the longest emergency department wait times in the country. 90% of patients wait up to 229 minutes to be seen, almost double the national figure. When ambulances are ramped outside of hospitals, people do not see a system performing strongly, they see a system under pressure. While ambulances are waiting outside hospitals, they are not available to respond to the next emergency call. In September last year alone, ambulances in West Australia spent 7,257 hours ramped outside of hospitals, the highest figure ever recorded. Every one of those hours represents an ambulance and a paramedic or a volunteer crew that cannot respond to the next emergency call. The pressure on hospitals. We should begin by recognising the extraordinary work of our healthcare workers. Doctors, nurses, ambulance crews, hospital staff and volunteers across West Australia work tirelessly to deliver care under immense pressure. They are not the problem. They are the reason the system continues to function so well. But even the most dedicated workforce cannot compensate indefinitely for a system that is already operating close to the limits. When hospitals are near capacity, before winter even begins, it does not take much to push the system beyond its limits. Winter illness arrives, emergency department presentations increase and hospital beds fill quickly. The demand on emergency departments continues to rise, with thousands of additional patients presenting to WA hospitals each year. That is when ambulance ramping increases, that is when waiting times grow longer, and that is when the pressure on frontline health workers becomes even more intense. One of the most significant pressures affecting hospital capacity sits outside the hospital system itself. That pressure is aged care. Hospitals depend on aged care functioning properly, both for people who require residential care and for those who can remain at home with appropriate support services. When older West Australians receive the support they need, health problems are identified earlier, care needs are managed sooner and many hospital admissions can be avoided. But when those supports are not available or when they become unaffordable, the consequences quickly flow into the hospital system. West Australia has already fewer residential aged care places relative to demand than the national average. The latest national data shows 59.1 residential aged care places per 1,000 older people in West Australia, compared to 65.4 nationally. At the same time, the aged care beds we do have are more heavily occupied, with 92% occupancy in West Australia compared to 89.9% nationally. That means when older patients finishes their acute treatment in hospital and requires ongoing care, there is often no aged care support available. They are medically stable, they are ready for discharge, but they have nowhere safe for them to go. On any given day in West Australia, around 200 hospital beds are occupied by older patients who are medically ready for discharge, but cannot leave because aged care support is unavailable. Either a residential placement or the support they need to return home safely. Doctors working in the system describe the situation as a small hospital worth of people occupying acute beds who no longer require hospital service. And the problem is not just how many patients are waiting, it is how long they remain there. The WA Auditor General found that hundreds of patients waiting for aged care or disability services spent around 40,000 additional days in hospital after they were medically ready for discharge, an average of more than 80 extra days each. In other words, hospital beds are being occupied for weeks or even months after treatment has finished, simply because the right care is not available. Those beds represent around 3% of the state's hospital capacity. Keeping someone in a public hospital bed costs around $2,300 per day, while the aged care system care costs closer to $350 a day. That means the health system is spending roughly $173 million each year delivering care in hospital that could have been provided for about $26 million in aged care or home support, a gap of around $147 million every year. In other words, West Australia is paying hospital prices to deliver aged care services simply because the right care is not available at the right time. And every one of those hospital beds is a bed that cannot be used for a patient waiting for an emergency department. There is also a growing gap in the availability and affordability of support for our people living at home. West Australia has significantly lower access to home care support than the national average. Only 4.7 per 1,000 aged over 65 receive home care support in Western Australia compared to 7.7 nationally. And when we look at those with the most complex needs, people requiring higher level packages, West Australia fails in again. Only 29% of recipients receive those higher level packages in WA compared to 33.6% nationally. These packages are designed for people who have experienced significant deterioration in their health or mobility. People who may have suffered a fall, a hospitalisation or a sudden decline that means they now require daily assistance. Without that support at home, the risk increases quickly. Falls increase, medication complications rise, hospital admissions become more likely, and once again, hospitals become the safety net. So I want to talk about the rising costs of home care. My office recently dealt with a case that illustrates the pressures families are now facing. A constituent contacted us regarding services delivered through a well-respected aged care provider. Based on previous statements, the service hours, the effects bundled cost of care under the previous system was around $154 per hour, providing roughly $1,613 per week in services for basic care needs. Under the new pricing structure, that equivalent cost has increased to approximately $234 an hour. That same level of care now costs around $2,456 per week. That's an increase of $843 per week, or roughly $43,800 per year. In hourly terms, that represents an increase of around 52% per hour. Sector modelling suggests prices increase of around 30% when management and administration costs were embedded into hourly service prices. But the experience in this case is significantly higher than that. This does not necessarily mean the providers are acting improperly. Many are adjusting prices in response to the structural design of the reforms and the need to embed management, travel and administration costs within the hourly service charge. But the result for families is clear. When home care provides more expensive, many seniors reduce services, change providers or delay accessing support altogether. Preventative care is missed, small health problems become crises, and those crises often end up in hospital. This is a downstream impact of aged care policy decisions on the state health system. And winter places additional pressure on every part of the health system. Respiratory illness increase, emergency department presentations rise, hospital admissions grow, ambulance demand increases. If hospitals are already close to capacity before winter begins, it does not take long for the system to reach its limits. West Australians do not expect perfection from their health system, but they do expect preparation. They expect the government to anticipate the pressures and plan accordingly. Yet what we have seen from the Cook Labor government is not a comprehensive plan addressing the full range of pressures affecting the hospital demand. Hospitals do not operate in isolation. They're part of a broader system that includes aged care, community care and primary health services. If those parts of the system are under strain, hospitals inevitably feel the pressure. At the beginning of this speech, I spoke about confidence. Confidence that when the winter arrives, West Australians can rely on their health system. Confidence that when someone calls an ambulance, help will arrive quickly. Confidence that when a family brings a loved one to hospital, they will receive timely care. And confidence that our seniors will receive the support they need before they reach crisis point. The Premier says West Australia has become one of the strongest health systems in the country. If that is the case, then the government should have no difficulty presenting a comprehensive plan for how the system will cope with the predictable pressures of winter. Because strength in the health system is not demonstrated through statements, it is demonstrated through preparation. Preparation ensures hospitals have capacity, the ambulance are not waiting outside emergency departments, and that seniors receive the aged care support that they need before they end up occupying hospital beds. Until the Cook Labor government delivers a plan that addresses pressures across the whole system, hospitals, aged care, community care, confidence will remain uncertainty. West Australians deserve a health system that is prepared, not one that is simply hoping to cope. And for those reasons, I support that motion.
Thank you. The member